দর্শক আপনাদের সবাইকে স্বাগত জানাচ্ছি আমাদের আজকের অনুষ্ঠানে। এই অনুষ্ঠানে আমার সাথে যোগ দিচ্ছেন ভয়েস অফ আমেরিকার সায়েন্স রিপোর্টার স্টিভ ব্যারাগোনা। Steve, welcome to our show.
Thank you.
We know that in the last few days, if not more than that, Omicron, the new variant, is dominating news everywhere. And so far, it is spreading. In the United States of America, we have seen that state after state is now detecting more and more Omicron infection among people. And same goes for rest of the world. More and more countries are saying that they have got Omicron patients. What do we know about this new variant so far?
So this variant first appeared in South Africa, or was first identified in South Africa. It was first identified during a big spike in cases in that country, and doctors there did some looking at the genetic sequence of the virus and found that it's changed a fairly significantly from the other variants that we have circulating. This one has something like it's got several dozen mutations in it compared to a handful of mutations that are found in variants like Delta. And some of those mutations have them concerned. They seem to make the virus more likely to spread more easily, and they may make the virus more able to get around the body's immunity. That's what's really got people worried, is that this might make the vaccines less effective. Now, before we get too far into that, you need to step back and say that so far they seem to be working fine. There is no indication right now that the illnesses caused by Omicron are any more severe than the regular variants, and the vaccines, they seem to be protecting people, as far as we know at this point, from severe illness and death. And the experts that I talk to say, really, that's what we want to be sure about. We want to make sure that this variant is not able to undermine the vaccine's ability to cause serious illness and death. What we're seeing is an increase in what these infections called breakthrough infections, where people who are vaccinated may get sick, but so far they've been mild cases. And the same is true of people who have had cases of COVID before. Omicron does appear to be able to infect people who have already been infected. That used to be, pretty good protection. But Omicron seems to be able to get around some of the body's natural immunity. Now, again, it's important to say that those cases have been mild so far. So I think that's why the WHO and other experts are saying this is something to pay attention to, something to keep an eye on. It's definitely raised concerns, but it's not something to panic about at this point.
We have also seen that this pandemic thing, and of course this Omicron as well, these are also dictating politicians around the world, including this country. President Biden has announced some measures in the light of these recent developments. What do we know about that?
Yeah, this has been something that the Biden administration really wants to get on top of, because when they came into office, the pandemic was, we had just gotten the vaccines when the Biden administration came into office. They just started being distributed in the United States. So he was, very pleased to have presided over a widespread distribution of the vaccines. And, the initial response was good. The number of cases went down, things were opening up, and then Delta happened. And with Delta, there's been this frustration among American citizens, among people around the world, really, that we're taking a step backward. And this is bad from a political perspective. So Biden is really trying to get on top of this. he has announced some measures that are aimed at trying to kind of tamp this down, sending what he calls strike teams to some heavily affected areas that will increase the number of healthcare providers in these places. Some of these some areas, hospitals have become overwhelmed because of the number of cases, and this will help to lighten the burden. He's trying to get more testing out to people, free testing, so that people so it makes it easy as possible for people to go get tested and find out if they have COVID, and then take the appropriate measures to limit the spread. They're trying to get more booster shots out to the public. Their officials here are really recommending that people get booster shots, which has been somewhat controversial because much of the world has not gotten their first shot. And so the administration wants to make sure that Americans get as much protection as possible. So there have been, the experts are saying that these are good first steps, but they would like to have seen the administration go farther and make testing much more available. There's an issue of access. You need to get these tests out to where people are, and that's not covered in this plan. And some other things that, this is sort of a good first step, an important step, but a lot of experts are saying that they would like to have seen the administration go farther.
As far as international travelers, there are now stricter conditions of traveling, including United States of America. And it is going to affect the global economy in so many various ways. We have seen that since the pandemic started, the global economy has been struggling. And this new variant, do you think it's going to affect the global economy in a big way?
It's hard to know. There seems to be, as you mentioned, there have definitely been some travel restrictions that have been put in place. I think the question is really how much patience people have for these measures again. We've heard people saying that we're not going back to lockdown. I think there's going to be one of the biggest impacts is going to be how safe people feel to go out. It may be less, we have certainly seen governments putting in place restrictions on international travel, but I think what's going to be the bigger economic impact is how individuals decide they want to, take on the risks of going out again. I think a lot of people have just decided that they're just not going to lock themselves up anymore. So we're definitely seeing kind of a loosening of the willingness of people to lock down. There's just a lot of frustration out there. Whether that loosening up and having more people go out leads to more infections and more deaths, if that happens, you're likely to see people, go back into their corners. But I think initially, with a lot of things with Omicron, it's really soon to say, and there's a lot of variables out there, and there's just a lot we don't know, and we'll just have to wait and see.
Many of our audience are in South Asia, in Bangladesh, and Bangladesh has a huge border with neighboring India, and India has already detected several Omicron patients in their country, and Bangladesh government has been very cautious about it, and they are also trying to enforce travel restrictions as far as possible. But hopefully in the next few weeks, it will be more clear how deadly Omicron is compared to the earlier variants. So it's yet to be seen. Anyway, but thank you so much, Steve, for your time today.
Sure. One other thing I can mention is about some of those travel bans. Do you want to do? Yeah. So I think one of the issues that's come up with these travel bans is there's an indication that they may help slow down the spread of the virus early on, somewhat, but they don't. It's not going to keep the virus out, as we've seen in this country. We put in a travel ban as soon as the first cases were detected overseas. Shortly after the WHO made its announcement that this variant was on its variant of concern list. And here we are, just a few short days later, and we've got cases popping up all over the country. So the travel ban did not stop the virus from making it into this country. And there's a lot of concern that these travel bans are not going to make much difference, no matter where they are put in place. That's seen as sort of a knee-jerk reaction and not necessarily based on science. So there's a lot of calls to kind of not impose these kinds of bans. They tend to be counterproductive and not terribly helpful.
Right. A leading scientist in WHO, World Health Organization, said today that people should not panic about Omicron. Rather, people should be cautious. The way people were cautious as regards the COVID-19 initial pandemic, people should, practice their usual cleanliness routine and other things like that, wearing mask outdoors and wherever people, I think indoors, wherever many people are gathering, that kind of stuff. So I'm sure people will be mindful of that. But thank you very much, Steve Baragona, for your time today.
Absolutely. Happy to do it.
দর্শক, আমরা এতক্ষণ কথা বলছিলাম ভয়েস অব আমেরিকার সায়েন্স রিপোর্টার স্টিভ ব্যারাগোনার সাথে। আশা করি আপনারা সাক্ষাৎকারটি উপভোগ করেছেন। সবাই ভালো থাকুন, নিরাপদে থাকুন। আপনাদেরকে ফিরিয়ে নিয়ে যাচ্ছি আর টিভির ঢাকা স্টুডিওতে।